Good afternoon, everyone, and welcome to a town hall with Council members Jim Oddie and Malia Vella. I'm Sarah Henry, the city's Public Information Officer, and I'll help moderate today's event. Council members Oddie and Vella have invited special guests Dennis Papalardo and Tracy Jensen, Alameda Healthcare District Board members, and attorney Tiffany Crane to join us today. Please note, all participants have been muted. To submit a question, please use the chat feature. Following remarks by our speakers, they will be available to answer your questions. I'd now like to turn today's town hall over to Alameda Council members Jim Oddie and Malia Vella.
Okay, hi, good afternoon, everyone. Thanks so much for joining us today. Obviously, there have been a number of different executive orders that have come down, as well as county health orders. The new order for Alameda County requires that folks wear face coverings or masks when they're out in public. And that'll be something that we can discuss today. But I also want to make sure that folks are getting information about our hospital here in Alameda, which is why we are so happy to be joined today by Dennis Papalardo and Tracy Jensen. Councilmember Oddie.
Thanks, Malia, or Councilmember Vella. Thanks, everyone, for joining today. Is this the third one of these we've done?
Yes.
So, you know, there's lots of questions. People need answers, and so we decided we were going to have these fairly frequently. So I think we had one a couple of weeks ago just to check in on housing issues. We had one maybe a week ago about what happened at the City Council when we passed some emergency ordinances. And this week we thought we would bring together folks from our hospital board, you know, Dennis Papalardo, our hospital board member, and Tracy Jensen, who also represents the healthcare district on the Alameda Health System board. So two of our more prominent and super qualified local officials that we're glad are serving us at this critical time. And I think next week we're going to have someone from the school board and also do a recap on the City Council, because there's another set of emergency ordinances on the agenda. So
yes, we
view ourselves as facilitators for this part, and I know there's going to be an employee type information presentation in the second half of this meeting, but I think if no one has a problem, I think we'll turn it over to Tracy and Dennis, and then at the end we'll come back and kind of answer any city questions.
And if you have any questions, just send them over via chat. All right, Dennis and Tracy.
Well, thanks, Jim and Malia. Thanks for having us. So I won't speak for Tracy, but you know, I don't personally have firsthand knowledge on what's happening on a day-to-day basis, but I know that so far, you know, the hospital in Alameda has not been inundated with COVID patients. And I'm also told that there are beds available, there are ventilators available at the hospital. I'm also told that hospital staff has an adequate supply of PPE, but again, this is anecdotal. I don't have firsthand knowledge because I'm not there on the front lines on a day-to-day basis. Tracy, do you have anything to add to that?
Well, you're absolutely right, and what I would add, and thank you again, council members, for inviting me. What I would add is that there is actually not been a surge at this point at any of the Alameda Health System facilities. So Highland Hospital, San Leandro Hospital, and Alameda Hospital acute care sites are seeing some COVID-19 positive patients. They're also seeing many patients that are considered to be persons under investigation who are admitted for something else and are being investigated and tested to determine whether they do have the infection. But at this point, what I can tell you is that Highland Hospital has the most cases at this point, about anywhere between 5 to 13 in the past month. And Alameda Hospital has between 0 to up to, I think, 6 has been the most persons under investigation. And I'm calling these persons under investigation. A lot of people are under investigation. They come into the hospital and then they go home, and even if they determine to be positive, they will go home and quarantine at home. So we have all of the programs in place. And some of you may have noticed at Alameda Hospital that there is a tent in the parking lot at the hospital. And that, from what I understand, I haven't inquired in the past 48 hours or so, but from what I understand, that has not been used to this point. And that's for in the case with the potential and to be prepared in the event that several people or a number of people come to the emergency room with suspected COVID-19 infection, and they would go, the tent would be set up. It is set up now, and there would be staff in the tent completely protected with PPE, and they would have the anyone who comes in from either walk-in or from the emergency transport to go there rather than go into the emergency department. And I can also say that at this point, which is very comforting to me as a board member of Alameda Healthcare District as well as Alameda Health System, that there are no cases in our post-acute, in our skilled nursing sites, which, as most people who have been paying attention to the news know, that that's really kind of one of the most frightening parts of the infection, is that when someone becomes infected in a post-acute site, a skilled nursing or a rehabilitation site, it's very easy for the infection to become transmitted. So those are kind of the statistics. And I will also follow up on Councilmember Vella, I think, is aware of this. Alameda Health System has been working very, very hard to obtain and provide access to personal protective equipment, PPE. Like other systems, the actual acquisition of the materials has been a challenge. The masks and the gowns especially, but particularly the masks, the N95 masks, have been a challenge to obtain high numbers of masks. And the instructions for use from the CDC and from other healthcare regulators and healthcare advisors have been changing a little bit, whether clinicians should wear them all the time, whether clinicians should wear them if they're sharing space or in a position that they might treat someone who is coughing or who has a potential person under investigation with potential COVID-19 infection. So what I've been working towards and what I'm urging and hoping is the case and going to be the case is as these masks come in, they need to be put into rooms, put into the floors, put into the units so that the clinicians have access. What I don't want to see happen is to have managers be distributing them according to some procedure that's come down from administration. And so I am working towards that, and I think some other members of the Alameda Health System Board are really focused on that right now, and that's really critical. So I think we have enough equipment, but it's just making sure that all clinicians, especially our nurses who are so close to patients, have access when they decide they need access. And I'm happy to take any other questions about the whole Alameda Health System, but I think Dennis is really aware of how closely Alameda Healthcare District is working with Alameda Health System too, to keep Alameda Hospital prepared.
For sure. I would just add one more thing, which is if anybody wants up-to-date information on what's happening on the front lines at the various hospitals in the system, including Alameda Hospital, we do have a board meeting on Monday at 5:30 of the Alameda Healthcare District Board. It's going to be a Zoom meeting. You can go to our website at Alameda healthcaredistrict.org and get the link for the Zoom meeting if you're interested. Luis Fonseca of AHS, I think he's the COO, is that right, Tracy?
Yeah.
Yeah, he will be presenting and he will provide us with a COVID-19 update.
So can I ask a couple questions? Is that okay? So one, I think Board Member Jensen, you mentioned that there are enough supplies, but if folks in Alameda wanted to help and support, our front end healthcare workers, I mean, what can we do? Can we donate masks? Can we donate supplies? What can we do to help? and be supportive?
That's a great question, Councilmember Oddie. And actually, if you go to the Alameda Health System Foundation website, I think there's a link at alamedahealthsystem.org or Alameda Health System Foundation. They are collecting PPE, personal protective equipment, to distribute to all of the Alameda Health System sites. And so since Alameda Hospital is part of Alameda Health System, there's no unique individual way to contribute directly with regard to PPE, but I am aware that there is a CASA, Concerned Alameda Sustainable Action, I think.
Mm-hmm. Yeah, Citizens
Alameda for Sustainable, yeah. They're doing actually having a donation for meals, meals at Alameda Hospital. So the CASA website has, I think they have a link. In fact, I've seen it. Yeah, they have a link for people who want to help at both Alameda restaurants and Alameda Hospital, Alameda Hospital staff and Councilmember Vella, you may know more about this than I do, but that's such a great idea. And I know that at Alameda Hospital and Highland Hospital, the staff have just been really, really thankful and really, really feel supported by this type of support. Yeah.
Yeah, you can donate through CASA. Also, Chris Tam at All Good Living has been doing the meal sponsorship, and where you can partner with local restaurants. There's a couple restaurants that are donating, and so he does it to families in need, and then also to our healthcare workers on the front lines at the hospital. I know I've donated a few meals, trying to support local restaurants that are doing good in the community. I know Joanne and Bobeck, who own Cafe and Jolie, and Donut Petite have also been donating donuts. So there's also local restaurants that you can partner with directly, and if you wanted to call up and sponsor meals or get them over, that are doing donations. And I know that it really does bring a smile to our frontline workers and let them know that people are thinking about them. So it's a great way to go. And I think through CASA and through All Good Living, it's like $15. For $15 or less, you can sponsor meals for a healthcare worker. So it's something to keep in mind, and it helps our small businesses too. So thanks for bringing that up, Tracy. I did have a question. I know that Eden Healthcare District authorized the expenditure of, I think it was $250,000 to buy masks. Is Alameda Health Systems going to be receiving any of those masks? I heard that they're coming in next week.
Alameda Health System and Eden Healthcare District aren't, we're not coordinating as far as I know on this. Alameda Health System has ordered masks actually, and is expecting, or I've been told that we have sufficient masks, that we've been ordering more masks, and that we're in partnership with some state providers, state nonprofits to get more PPE. But as far as I know, that's a great question. And if we're not, I'll definitely mention it, that we should check with Eden and see if those, especially at San Leandro Hospital, which was a part of Eden Healthcare District at one time, that would seem logical.
Right. Yeah. And I know that a couple of the board members are from San Leandro, and I think I've reached out to them to ask where the masks are going to go. I know that they've designated some for St. Rose, and I know that I was one of several people that had called them up to see if there was going to be PPE designated for San Leandro or any other hospitals. So
well, that's great to know. I'll check into it too. Thanks.
Thank you. My other question is, you know, for folks that are having symptoms, what should they know if they're going to go in, or what should be the deciding factor if they decide to, you know, should they go into the hospital? What should they do?
Well, first of all, the hospital, the emergency departments at Alameda and Highland and San Leandro hospitals are well prepared for anyone who feels the need to go to the emergency department, but that's not the best thing to do. We've been told, and the public health information is really clear, that the first thing to do, if you do have a doctor, and there are people, unfortunately, in our community that don't have a personal physician or a primary care physician, and that's unfortunate, but there are clinics in the community. Highland Hospital has several primary care clinics that even if you're not a patient, you can certainly call there. But if you do have a primary care doctor, if you are part of a healthcare system, the best thing to do is to call the information line, call your doctor's line, and explain your symptoms. And I understand, and I know that that some of the community care clinics, as well as Highland Hospital, is working with Alameda County Healthcare Services Agency to go out in some cases to see a patient rather than have someone come in who's very ill. And I have to say, I have to put this in here. To me, it's really unfortunate that, and I think it's part of Alameda Health System's financial decisions, but the city of Alameda had and continues to have the community paramedic program, which has gotten smaller over the past 2 years. And that would be and should be a really great program to do this kind of outreach and this kind of intervention for people who are not having their own physician and who would feel comfortable and safe having a paramedic from Alameda, from our fire department, visit them in their home. So that is a tremendous program. It's not, as far as I know, it's not being used right at this time for outreach and support to potential persons under investigation or persons who feel that they may be infected with COVID-19. But, and I know that our firefighters, that would be another thing if someone is feeling or paramedic, excuse me, if someone's feeling very sick and feeling that they have a fever and they have a cough and that they may have COVID-19, then unfortunately calling for an ambulance is something that potentially could not be the best thing to do, rather than calling your doctor and finding out the best way to either go to a very safe and safe site where infections are controlled. But if you need to, and if you're very sick and you have a high fever, you just call 911, because Alameda has the best paramedics and firefighters anywhere.
I would just add, I agree with everything that Tracy said, but if you do need to go to the hospital because you think that you might have COVID, or you're having symptoms, you're having respiratory issues or a high fever, please identify to the nurse or whoever greets you. Let them know that you think you might be a COVID patient, because what they will do is take you into a separate area. They're triaging potential COVID patients in a separate area.
Okay. And I did have a follow-up question. I know that there's a lot of people that have postponed kind of regular procedures or routine procedures, minor surgeries and things like that, obviously, thinking that not knowing what the shelter order, how long the shelter orders were going to last. Do we have a plan for eventually kind of doing the routine medical checks and surgeries, or opening up for that again? I know that there were a lot of people that canceled in an abundance of caution. Does Alameda Health Systems have a plan for that?
Oh, absolutely. There's a plan for our clinics, unfortunately, aren't seeing a lot of very patients with health needs, pediatric patients. So Alameda Health System has 5 clinics throughout the Bay Area, and these are places where community members get their primary care. And so those visits are down, as well as all elective surgeries throughout Alameda Health System and throughout hospitals in California. So I know that there is, we've discussed it, and there is a plan to ramp that up. And a lot of our providers, our surgeons and our elective procedure physicians, they're community doctors. They're doctors in private practice in Alameda, San Leandro, Oakland, and they're definitely available and eager to help patients and to do those procedures, but no one wants to put anyone at risk, a patient at risk, or the providers especially, to do this during the pandemic. So we're taking kind of a wait and see attitude for that.
Thank you.
So I had a couple other questions, but I'll hold them to the end because I think we have some questions from our callers. But I do want to just give a second and give a shout out to Sarah Henry. Sarah's our PIO.
Yes.
You know, under normal circumstances, she does an amazing job getting the message out in the city. But now, you know, everything is about communication. Everything is about information. So she's been, you know, doing yo person's work, and, you know, also supporting the council and the staff, and, you know, supporting residents and making sure that they have as much information as they can about Alameda. So she's going to moderate it, but I just want to give her a shout out before I turn it over to Sarah to, you know, ask the questions.
Thank you so much, Councilmember Oddie. I have two so far, and so just encourage the folks to use the chat feature to submit your questions, and then as they come in, I'll go ahead and pop in and ask folks the questions. The two are related, so I'm going to ask them both at the same time to be addressed. They're both related to testing. The first question is, when and where can we be tested without having a fever? And then the second question is, when will wide-based testing be available?
That was one of my questions, so thank you.
I mean, Tracy may have a better answer than I do, but we don't really know at this point. I mean, you can't go into the hospital and just get a test. Testing is not available on that basis right now. When will we have, you know, when will everyone who wants to get tested be able to get a test? I don't know.
What I can say, Alameda Health System, like other sites, is working with various providers to do tests. And what I am excited about is that Alameda Health System and the Healthcare Services Agency in Alameda County, I think it's going to, if it hasn't already started, it'll be starting in the next few days. They're going to be able to do on-site testing that will take less than an hour to get the results. So that didn't answer the question completely, but it's really critical that when a patient comes in, someone comes in and they feel that they may have an infection, they have a fever, they have respiratory issues, that they're able to be tested and the results can be provided immediately, so that the person can either be admitted or be quarantined, and that follow-up can be done with contact. So that's the Healthcare Services Agency has been really, and the Alameda County Public Health doctor physician have been very supportive and really moving quickly on this. We have tests, and I'm looking right now. I wanted to let everyone know at this point, the Alameda Health System has done, as of today, has done 611 tests. And out of those tests, the 566, sorry, I'm trying to find this on my phone, 566 were negative. So there, and some of them, total tests, actually, I should say 611 have been done, tests have done, 45 tests are still pending. So we're working pretty quickly to get test results at Alameda Health System. And then the positive results out of those 611 minus, out of this 611 minus 45, the positives are 61 and the negatives are 505. So that's kind of a snapshot, a high-level snapshot of the testing. And again, as my colleague Dennis mentioned, we will talk about this and we'll have updated numbers at the Alameda Health Care District meeting on Monday. But to answer the question, if you need a test, if you feel that you have the symptoms, again, call your primary care doctor. And if you feel necessary, then please go to the emergency department at Alameda Hospital or any emergency department and let them know, either by calling or before entering, that you do feel. And I can say it at Highland Hospital, Alameda Hospital, and San Leandro Hospital, you'll be asked before you are in contact with others or with clinical staff whether you have a fever and whether you have any symptoms of COVID-19. So the best thing to do is wear a mask and call your provider. if you don't have symptoms, it's my understanding that Stanford has been doing some testing. There's a testing site in Hayward, and the council members may know more about this. I think it's being run by Hayward Public Safety. So
Hayward Fire.
There are places, yeah.
Yeah. My understanding with Hayward, the Hayward testing site, is that it's being run out of Station 7, which is one of their newer stations, and it's attached to a health clinic. And they are doing several hundred tests, I think a week, or even I think they can do up to a certain number of tests a day. But you have to have 2 symptoms. One of the symptoms needs to be a fever, is my understanding. And then you go and you wait in line. It's a mobile testing site. They're being staffed by volunteers from the Chabot Fire Academy, and then by some folks that they've contracted with from a local ambulance company. And then there's also their fire paramedic staff on site in case there's an issue where somebody would need to be need acute care or to be transported.
I should also add that anyone, any community member who works in a healthcare organization and provides care, either long-term care, who works in a skilled nursing, who works with seniors, who has contact and is actually an essential provider, all of those people, as I understand it, can be tested regardless of symptoms. People who are providers.
Right. Any healthcare providers or emergency first responders can be tested. Yes. And that's true. And that's part of the reason why it's open also to countywide, is because they've gotten the funding for the test from Alameda County Board of Supervisors. My understanding with the test site that's been opened in Oakland, it's the same thing in terms of any sort of healthcare worker or first responder can go and get tested there, especially if they think that they've been exposed. They're encouraged to go and get tested without any symptoms.
I think that the city of Oakland, I know this, I don't actually think it. The city of Oakland is opening a testing site. I believe it's going to be near the West Oakland BART station, and it's going to be prioritized for first responders and emergency workers, but it's going to be a public site as well. So that'll be another opportunity.
Yeah, and that's supposed to open this week, correct?
Yeah.
Tracy? Yeah.
There's a few additional questions regarding testing. Here's one that says, how can we have an end date to return to work without more advanced testing? And then a follow-up question to what Tracy was just saying is, what happened to the 61 people who tested positive at Alameda Hospital? Are they hospitalized or quarantined or at home?
Let's be clear. The 61 people were not at Alameda Hospital, right, Tracy?
That's throughout the system, and it may not have. They may have been even through providers at clinics or going to emergency departments, or they more likely were patients who were already in the hospital, any of the 3 hospitals, and or any of the long-term care sites who were tested and found to be positive. But most people, and this is true, and the Alameda Health System Board has asked this question many times, most people, and I don't know the number of the 61 that the questioner requested, but most people are being advised, if they are not, if they don't have compromised immunity, if they're not showing really severe symptoms, to self-quarantine. And that's what Alameda Health System's been doing.
Yeah, Tracy, our last meeting, I can't remember if it was April 2nd or April 7th, but as of that date, we had no positive tests at Alameda Hospital as of that date. I know there have been some since then, but I don't think it's been that many.
That's a great question. And as of yesterday, the 17th, there were 6 patients at Alameda Hospital who were under investigation. And those were people who had come to the ED or who were admitted for a symptom, but whose tests were not returned. And I'm, by our meeting on Monday, the information that I requested from the Alameda Health System staff is that we know who persons under investigation is really critical to know how many people are awaiting tests, but we need to know how many people are positive, where the persons who are positive are going. To the last question, are people going, and most people sheltering at home and quarantining at home, or are there many people who are being admitted to the sites? At this point, I can say that we haven't had a large number of admissions. There hasn't been a surge, and it could happen today, unfortunately, or tomorrow. So we need to be prepared, and that's what I think everyone needs to know, is that Alameda Health System is working very hard to be prepared.
Yeah.
And the other part of the question, and Malia, feel free to chime in, but that's the policy decision we have to wrestle with. I mean, I think that's exactly right what the questioner said. How can we reopen without testing? I don't know if you saw the Santa Clara study that came out, I think it was yesterday, that the infection rate, could be, 45 times what people are thinking it is now. So I can say that we're working at a local level with whether it's Alameda Health System or the county or our partner cities or the state to try to do this, because that burden has fallen on us. Unfortunately, the federal government has kind of been AWOL on this, but that's something that we have to prioritize and we have to work on. So,
yeah, I mean, I don't think we can safely reopen until we have widespread testing, right? But that the whole point behind that is the assumption that if you've had COVID, then you have the antibodies, right? And you can't get it again, but that's not even known for sure at this point either. So there are so many unknowns at this point.
Yeah, I saw something about that today, that some folks in China that had it are now testing positive again. So
correct. That's right.
Here's another question from somebody saying that they've been quarantining separately from their parents who have also been quarantining, but when the shelter in place is lifted and they haven't shown signs of, when the shelter in place is lifted, they haven't shown signs of the virus, how can we know when it is actually safe to get back together?
Well, I think we have to follow what our health experts are telling us. So I don't know the answer to that, but I hope that we, as a society, we will have an answer to that once we reopen. That our health experts will tell us, what the rules are. When can we start being with our loved ones again that we're not able to be with right now? When can we start going to work again? Those sorts of things.
And that's a really good answer. I mean, in Alameda County, we have a tremendous. I've been very impressed with the Healthcare Services Agency and with Dr. Pan, the public health director, the public health physician for Alameda County, and they're, I know, doing outreach on a daily basis with elected leaders, including, I think, Alameda Council and leadership there. I know weekly there's a call with other elected officials throughout the county. And so we're relying really on the public health department in Alameda County and the state, health leadership to provide information, to share best practices, and to identify how quickly we should stop or relax some of the sheltering requirements.
Yeah, but to your guys' points, I think the governor said this morning that the curve is flattening. And 2 weeks ago, we were all worried that there would be a surge that our system could not support. And Tracy, I think, reported out that so far we haven't seen that. So what we're doing is working. I know it's frustrating. It's frustrating as an Alamedan. It's frustrating as an American. It's frustrating as someone who enjoys freedom. But what we're doing is working. So we have to stick it out a little bit longer. And that's why our council has some things on the agenda next week to help our renters, help our business people, help our commercial tenants that we're actually the landlord for. So I just want to plead patience with folks because it's super frustrating, and we all share your frustration. But we are going to get through this together, and I think we're doing a good job so far.
No, I think you're absolutely right, Jim. I mean, I think we have a lot to be proud of here in the Bay Area and in California. If you look at other areas of the country that were late to the shelter-in-place orders, and they're seeing much higher numbers than we are. If you look at the per capita in California, as far as cases and deaths, we're much lower than most states. So we can really be proud that our leaders here in the Bay Area were really on top of it and keeping us safe.
Sarah, do we have any other questions?
Nope, I don't have any. Just a reminder to folks to ask your questions using the chat tool.
I have one more if you guys don't mind. I think, Tracy, you mentioned earlier that we haven't seen the issues with our SNFs, our skilled nursing facilities. And, you know, can you maybe talk about some of the protocols that we put in place? Because, you know, we did have one of our public safety officers, you know, test positive early. And I know that the city and the healthcare district and the different SNFs did put some of these things in place, which probably saved hundreds of lives. So if you want to just maybe fill us in on what some of those protocols are and what you're all been doing there.
The main thing, the number one thing that the skilled nursing and Alameda Health System's skilled nursing includes the Alameda Hospital skilled nursing beds that are adjacent to the hospital, as well as Park Bridge Center, which is 100 beds almost of skilled nursing. And so the main thing that's really been effective, but it's challenging for families and for the residents of these sites, is that we're eliminating visits. So unfortunately, if you have a family member or you are a resident of one of the sites, you're unable to see anyone outside of the facility. And that's been a very big challenge. And I just have to give a lot of support and a shout out, I guess, to all of the residents, especially residents who've been at Park Ridge for a number of years, perhaps, and they're used to getting out and used to seeing others and to seeing family members and friends, and unfortunately that is not that's not something that's going to happen during the time that we are in the pandemic situation. And so the other thing that we're doing at these sites is checking staff. Staff is been found, unfortunately, to become infected as well as to transmit infection. And so we're checking staff who work at these sites as to making sure that there's no symptoms. And by the way, I should say that Alameda Health System has expanded, tremendously expanded the benefits for persons who have been diagnosed or who feel sick or who may be under investigation for COVID-19, and as well as providing childcare for providers who are coming in and ensuring that providers are available. But I mean, the thing is, we need to make sure that providers are healthy so that all residents and all patients at all sites are healthy. And that's, I think, what I've been urging and what the system has been looking at and supporting. Did that answer your question, Jim?
Oh yeah, it did. Thank you. I want to thank you guys for coming on. You're welcome to stick around for the second half. Dennis, it might be interesting to you because you represent workers who are injured on the job. I'm going to turn over to Malia, who's going to introduce our speaker for the second part of our town hall.
Thank you. Thanks again, Dennis and Tracy, for sharing all that insight and information. It's really helpful.
Thanks for having us. Stay safe.
Thank you.
Thank you. So we're going to transition to the next part of our town hall, and that is with attorney Tiffany Crane. Tiffany is a labor and employment law attorney with a firm that actually has an office here in Alameda. And she is going to do a brief presentation on the different types of COVID-19 related leave laws, as well as make herself available for a little bit of Q&A afterwards. So with that, Tiffany, I will hand it over to you. Thank you so much for joining us today.
Thank you.
Hey Tiffany, this is Jim. Is that a USF diploma in the background there?
USF?
I have one of those too.
Same law school.
All right, so I'm going to trust everything you say.
Change the world from here, right? That's what they say. Well, thank you everyone for having me on this today. I'm going to talk a little bit about some leaves. I think Sarah's going to share a screen with you of a PowerPoint presentation so that you can get some information. I can make this presentation available to you so you can find it. I'm going to talk about a few different things. First of all, you may have heard at the end of March, there was the Family's First Coronavirus Response Act, and that has 2 leaves available. So I'm going to talk about those. I'm going to talk a little bit about unemployment benefits that have been expanded by another act that was later passed in March, and then how you can coordinate those 2 benefits. So next slide, please. So the first I'll talk about is the federal act that was put into place, a Family's First Response Act, and that is that was signed by the president, I think effective on April 1st and is effective through the end of the year. It applies to all employers with less than 500 employees. So there is a big exemption for large employers, which I'm going to talk about in a minute. The governor has made has expanded just a little bit for some workers in California for employers for over 500. There are some exempt employers or possibly exempt employers. If there's a business that has less than 500 employees, that business can, on a case-by-case basis, not on a blanket level, but on a case-by-case basis, when individual employees come in and request these kinds of leaves, they could be exempt. They're going to have to collect data and possibly show eventually that it would be an ongoing concern for the viability of their business should they have to allow for this leave. So it's not an automatic exemption for those employers, but it's a possibility. There's also 2 really big exemptions: healthcare providers and emergency responders. So we know that, and we are so appreciative of the workers that are in those industries. Those employers may exempt their employees from these 2 leaves, and there are 2. One is the Emergency Paid Sick Leave Act, and the second is the Emergency Family and Medical Leave Expansion Act. I'm going to talk about both of them in detail. Next slide, please. And so first of all, I'll tell you about the paid sick leave and who is eligible. So there's 6 categories of folks who are eligible. I'm going to note that the first 3 categories are categories in which if a person claims the paid sick leave under this category, the first 3, you get full pay, the full regular pay that you would be paid. And then the last 3, the ones that are not in bold, you would be paid 2/3 of your salary. So it's a person who's subject to a quarantine or isolation order, and the Department of Labor has come out to specify that that does mean the quarantine isolation order that we have in place. There's in the Bay Area counties and several other counties surrounding. I know Alameda County has one of those orders, and the state has an order right now. So really anyone in the state of California would be subject to this qualifying quarantine or isolation order. If you're advised by a healthcare provider to self-quarantine, and there's been more guidance come out on that includes someone who might be specifically vulnerable because of a condition that might make them more vulnerable, so they can seek out an advisement by their healthcare provider, even if they're not specifically affected by COVID-19 now, but they could be, and they're at heightened risk. Third, if you're experiencing the symptoms of the illness, so they specify those as to be the illness symptoms that we've heard about, the coughing, the fever, those symptoms. Those 3 would be at the regular rate. The next 3 are if you need to care for someone who's subject to the quarantine. 4th, if you're caring for a child, because the childcare facility, as we know, childcare facilities and schools are all closed right now. So that would qualify all parents having to stay home with their kids. And lastly, if you're experiencing other substantially similar conditions. So you only have to qualify for one of those, not of a combination or all of them, just one. Next slide, please. There's no requirement for the paid sick leave, the emergency paid sick leave. There's no requirement that you be employed for a specific time. So you might be aware that in California, we have paid sick leave for everybody in California. If you work over, I think it's 60 days, you have to at least work for 60 days. This leave is available as long as you're an employee at the business. It does not require you to be there for a certain amount of time. Full-time employees can get 2 weeks. Part-time employees are going to get the portion of the regular number of hours that they regularly work in a 2-week period. It's paid at the rate of $511 a day as a cap. And so over the course of those 2 weeks that are available for workers, it's a max of $5,000. And that's only if we're talking about the first 3 categories that I talked about, that if it's your own illness or you're caring for yourself. If you're a caregiver, the max is going to be $200 a day or $2,000 over the 2 weeks. You can take this before you take other leaves. So an employer cannot force an employee to take another benefit or leave that they may have accrued through their collective bargaining agreement or through their agreement with their employer, like vacation or sick leave. You can choose to take this first. That's the employee's selection. And intermittent leave can be an option. So that means that an employee might say, well, I really only need 1 day a week for this paid sick leave, so I'm going to arrange with my employer. So there has to be an arrangement between the employer and the employee to have that kind of intermittent leave. And there is much more flexibility for those who are able to work at home, because the idea is that if a worker has access to the workplace, they're more likely to infect someone else if they're taking leave to care for someone who might be quarantined or might be ill and then showing up to work. So their intermittent leave is more expansive for those that are working from home. Next slide, please. And the eligibility for the expanded FMLA. So you all might be familiar with the FMLA. Requires you to be an employee for at least a year before you can apply for it. It's an unpaid leave. This is an expansion and adds a new reason to take FMLA, and it lessens the requirements. So you can be eligible if you've been an employee for only 30 days, and that's at the time that you request the leave. So theoretically, someone could start working today for a business and not request the leave and for another month, and they would be eligible because they've been an employee for 30 days. If an employer has fewer than 500, so again, that huge exemption applies. Big businesses do not have to comply with this law. And the single reason that someone could take this expanded FMLA, the only reason, is that they must care for a child under the age of 18 because of school closures. So this is going to be the only reason that the FMLA can be taken. And they can be stackable. So if go to the next slide, please. So the first 2 weeks of this 12-week leave of the expanded FMLA may be unpaid. However, you can arrange with the employer so that the first 2 weeks are paid by whatever other leave you might have available to you. It could be paid sick leave that you have accrued at your employer. It could be vacation time. It also could be the emergency paid sick leave. So the 2 weeks that we just talked about, the emergency paid sick leave at the federal level that everybody gets, if you work for an employer that's under 500, you can use those first 2 weeks to be paid at the paid sick leave. But the regs have made it clear that the intent was that it's for only the reason of caring for a child. So that fourth reason that we talked about. So that's the only way you can make them successive for those 12 weeks. And the pay is going to be at a 2/3 rate after those first 2 weeks. So the last are at 2/3 rate of your pay. And there is also a cap on this. It's $200 a day or $10,000 total for the 10 weeks of pay. It could potentially then be even higher than that if you get paid for the first 2 weeks. The last 10 weeks are a cap of $10,000. You can add, as I said before, the other leaves on top of it. It's stackable. And intermittent leave is also available for this. Again, you have to make an arrangement with your employer to do that. We've had a lot of questions about this. If you've taken FMLA, the traditional FMLA, like if you are yourself ill or you have to care for someone else, or maybe you had a baby, or you adopted a child in the last 12 months and you took some time, you're going to be able to receive this expanded FMLA if you still have some of those 12 weeks left. If you only took 4 weeks, for example, in the last 12 months, you're going to still be able to take, do the math, 8 months or 8 weeks, excuse me. So if you haven't taken any FMLA in the last 12 months, you are eligible for the full 12 weeks. All right, next slide, please. This law also, as FMLA traditional, allows for or requires the employer to restore the employee to their position, the same or equivalent position, after they come back from their leave. They make a small exception for employers that have 25 or fewer, and that is that they have to make a reasonable effort to reemploy. So let's say a very small business, they have to eliminate a position of a person who took a leave while they're gone. They're not required to bring that person back, but they do have to, for a year after that person returns from leave, give them a call back if their position is recreated. Next slide. So how do these coordinate together with other benefits? This leave is in addition to anything that you might already have. So your CBA, if you're in a union, or if you're not in a union, what other leaves you might have, like at the state level, there's at least 3 days a year of sick leave, or you might have some vacation. This is going to be on top of that. An employer cannot require that an employer use their paid leave before this. So this is something you can take first and save the rest of your leave for later. Next slide, please. And under the paid sick leave for the first 2 weeks, as I mentioned before, both the employer and the employee must agree to supplement that time for pay. Because the FMLA expanded could be unpaid for the first 2 weeks, you should make an agreement with your employer to make sure that that first 2 weeks are going to be paid with paid sick leave. And that's, again, only for the school closures to overlap in that way. And for both of them to be an employee to be eligible for either one of them, either the employee or the employer can demand the employee use other accrued leave during the unpaid 2 weeks in the beginning. All right, next slide. So go that one, yeah. Okay, so just this last week, we got some really great news from the California state level. The governor said, hey, look, we've got this huge exemption for these large employers, 500 employees or more can be exempt from this law. But we also know that we have these unsung heroes that are out there every day, driving food to the stores, out there in the stores, making sure that we have food on our table. And we want to make sure that those workers too are covered. And so the governor put out an executive order that gives 2 weeks to workers that are employed by employers with over 500 employees. This is just Thursday, so this is fresh, brand new, just announced by the governor. And the eligibility is very similar, but not exactly the same as the federal level, which is that if you're sick or you're subject to a quarantine or isolation order yourself, then you can be, or you have a medical reason. You have a doctor or some kind of healthcare provider that's saying, I'm subjecting you to this quarantine, then you're going to be eligible. And I want to make it clear, this means that this is to add to what we already have. So it's only for employees that are otherwise exempt by the federal level. This is not an addition. This isn't an additional 2 weeks. It's 2 weeks for the employees that work for employers that have 500 or more, those exempt employers. And we're talking about, who are we talking about? We're talking about large food service employers, farm workers, agricultural workers, delivery drivers, fast food chain workers. And so all of those workers with these large employers now have access to these 2 weeks. All right, next slide. And also the governor a couple weeks ago said that they're going to $100 million and he's prioritizing, or the state is prioritizing the essential workers. So we know that a lot of folks are still working, are heroes out there that are essential workers that cannot stay home because we need them to keep the food on the table, to keep healthcare going. All those workers who are deemed essential are going to get first priority for this funding for childcare. Next slide, please. I'm going to talk briefly about unemployment, and then we'll get to a Q&A. Unemployment benefits, we also saw an expansion of unemployment and funding to states from the federal government through this legislation. So we have $250 billion more for unemployment insurance than was already provided. So you were, it was already going to be 60 to 70% of wages for 26 weeks. That's what you get if you are an unemployed worker and you go on unemployment. You have up to 26 weeks and only 60 to 70% of your pay. So this law is making it and expanding it so folks get more each week and up to $600 per week more, and additional weeks, so up to 39 weeks now. Next slide, please. And it also makes previously uneligible unemployed eligible. So they're calling it the Pandemic Unemployment Assistance, or PUA. This is a brand new program. The state is expanding its availability. So I think EDD, the department at the state level that goes through these applications and issues benefits, unemployment benefits, they're open now for 8 hours a day. They had a 4-hour period per day. Now they're open every day, all day long. I think it's 8 o'clock to 5 p.m. And they're now also expanding who is eligible. So self-employed individuals, freelancers, independent contractors, part-time workers who would not otherwise be eligible. So they're really expanding it to make sure that everyone, or almost everyone, is able to access this benefit. Next slide. And so they've clarified that the EDD has clarified that there's going to be a specific time period that you should go to get these benefits. It's up to 39 weeks now, as opposed to before 26 weeks for the benefits to start. And it has to start with the weeks of unemployment starting back to February 2nd. So if you apply, let's say a person applies and there's a delay in getting it, you can actually get this retroactive to February 2nd through the end of the year. And only weeks of claim between March 29th and the 31st are eligible for that extra $600. So all the other weeks are going to be the 60 to 70% pay that we talked about. But if there are claims between the 29th and the 31st, 29th of March and July 31st, during those weeks, there's this eligibility for an expanded $600 from the federal level. And California EDD has said that under this new benefit, independent contractors, self-employed, among those, that if you are not a citizen, you must be have valid work authorization. So this is one of those benefits that unfortunately is not a benefit that everyone who contributes is able to have benefit from. So the workers who apply will have to show work authorization to be eligible. Next slide, please. And here are, I'm not going to go through all the different reasons, but you can take a look at this. I'll make this presentation available. These are all of the ways in which EDD has clarified that a worker would be eligible. So just a couple of examples would be if you're diagnosed with COVID-19, if you're unable to work because a healthcare provider has advised you to stay home, and the list of reasons there. Next slide, please. All right, when employees file an unemployment insurance claim, an employee should file immediately. If you're not sure whether you're an employee or an independent contractor, file anyway, because you will be eligible in this new era, the PUA era. And this includes folks who think they may be an employee under AB 5. Okay, so AB 5 was a law that passed late last year, and it clarifies more of who is an independent contractor and who's an employee. And specifically, it was geared towards Uber drivers and Lyft drivers, those that the companies had that are independent contractors. The law was really targeted to try to fix and make employees. So if you think that you're eligible, we're saying go and apply for unemployment, and the state will decide because there's no penalty to applying. Next slide, please. And here's how you apply. There's the website there. And again, when you're in doubt, apply, and EDD will make the determination. And there's a little bit more information about the programs there if you want to go to that website and get more information about unemployment. I think that's the conclusion of our presentation.
All right, thank you so much, Tiffany. Sarah, do we have any questions for Tiffany?
No, I haven't received any yet, and it might have been just could have been a delay also with the screen share. So if anybody has questions, please enter it in the chat.
Okay, and I actually do have a question for Tiffany. Tiffany, I know that the unemployment scenarios have changed substantially for folks. Before there was a 1-week waiting period. There's also been questions for independent contractors. What is if you could just review maybe a couple of different scenarios so people can kind of understand how unemployment may have changed or the different determinations. And then also if you could review the go live date and process for folks who are self-employed or were independent contractors.
Yeah, so April 28th, I think, is that what you're talking about? April 28th is
Yes.
going to be when, if you're an independent contractor and you're going for the pandemic unemployment insurance, that's going to be the day after which you want to go and apply. And that's one of the major differences is that there's this expansion of who's eligible for unemployment, folks that were not able to before. Also, like you said, there's now not a waiting period, so you don't have to wait 7 days to submit your application. You can apply right away. And I think another really big thing is that there is going to be this period where folks are going to be paid much more than they would normally. The 60 to 70% of the pay is what you're usually eligible for. But the federal government has allowed a bit of an expansion, at least for a short period, where folks can get paid up to $600 more.
And if are people going to have to do anything else to qualify for that additional amount, or is that just part of the process?
I don't know if you're going to have to do anything additional. I think it just is part of the funding. I don't think you have to indicate something on your application or anything. It should just be automatic so that you get more with your benefits.
Yeah. I've heard from a few people who have been denied over the past couple of weeks that have put in claims. Some of the reasons that I've seen for denial, and I think it'd be helpful if you could maybe go over that. But I know one of the ones that I've seen several times is people have put return to work dates as the day after different shelter orders. Can you explain why that would result in a denial?
Actually, right now, I don't think that should result in a denial, but because shelter orders now keep being expanded, it shouldn't be a reason to be excluded. And I think that's one of the larger expansions is that even if you might be going back to work at some unknown time in the period, EDD, in the future, EDD is saying that should not make you ineligible right now. I forgot your other question.
I think if there's any other reasons that they would typically deny that they're no longer denying folks for.
Oh, actually, I remember you said something about being denied. And if you've been denied for the reason of being an independent contractor or something like that, you should reapply come April 28th, just to be clear. Just reapply, even if you applied and you weren't eligible or you were told you were ineligible, apply again.
Starting on April 28th?
Yeah.
Okay, great. Sarah, do you have a question?
Nobody's asked, no questions.
Okay.
I do have a comment. I think to Councilmember Vella's point, and she used to have a similar job that I did, so she can chime in as well. But your state elected officials can help if you think you've been, unfairly denied, or if your claim is hung up in the process. So reach out to, State Senator Nancy Skinner's office or State Assembly Member Rob Bonta's office. I mean, they may not be physically in the office, but I know they're all still working to try to make sure that the state services are available to everyone here in their districts.
And I think we haven't seen, obviously, we don't know what the EDD website's going to look like on the 28th or what the questionnaire is going to look like. And this is kind of uncharted territory for folks. Can you talk a little bit about, I know that there was a new executive order expanding the timeline or the hours that EDD is going to be available for?
Yeah.
If folks have call-ins and stuff like that.
Yeah, there was an expansion of the time, I think it was just this last week. Generally, it was only 4 hours in the morning each day, but now they've got it 8 hours a day. And they've also, thank you, SEIU 1000, who represents the state workers, have made available, I think it was like 600 people, state workers, who were doing other jobs, who are now going to be commissioned to processing these applications. And they've also said that the applications had, I think, a 2 to 3 week turnaround period. So a person would apply and then receive benefits between 2 and 3 weeks later. And they've kept that turnaround period. That's the normal period of turnaround for somebody to get benefits after they apply. And so, even with the inundation of applications, they've been able to staff EDD and open up the hours so that they can process the applications and be able to have the same turnaround period. So hoping, even with the expansion, maybe even quicker, but you can expect probably about 2 to 3 weeks before you start receiving benefits after applying.
Okay, thank you.
Yeah, you're welcome.
I have a question, Tiffany. I'd love to ask on behalf of my brother. Your presentation was terrific, and my brother is a musician, and he goes on tours and things like that. But he's a struggling musician, as many are, and so when he's not on tours and doing his music, he's also he drives Uber, and so right now he's in an awful spot where he's unable to drive Uber, and the future for when his band is going to go back on tour, who knows what that looks like. And so he's definitely going to apply for the unemployment, but it seems like this difficult, like he kind of has 2 jobs, and even both of those jobs, I'm not sure, when he's on a tour, for example, he gets a per diem, but that I don't think is calculated in his income. So I feel like even his unemployment, I don't know how they would really get him the help that he's going to need.
Yeah, that is a very difficult situation to be in. And I think that EDD generally would look back and would be looking back to what the average of the person receives over the last period. So he's probably going to have to provide his what he's been able to receive just in terms of payment in his 2 jobs over the last maybe 6 months to show what was the average that he was receiving in order to determine what the number of or the level of benefits would be. But that's what is good about this expansion, is that he is going to be eligible for unemployment right now. And that reminds me of something that I didn't mention during the presentation that I think is pretty important. And that is that in order to be eligible for these federal leave programs, they made it really clear, and it wasn't clear at first when the law came out, but they made it clear now with the regulations that to be eligible, you have to either not be able to work or telework. And so the work one is a little bit less clear than what we thought. It has to be, in order to be eligible for this quarantine eligibility, it has to be that you are, the reason why you're not available is the quarantine. So there's work for you, but because of the quarantine, you can't perform it. And that is to say that, for example, if a cafe has to close because they're not receiving enough customers to stay open, then the cashier at the cafe, there's no work for that cashier because the cafe is closed. So that's an example of someone who could not work right now because the cafe is closed. It might seem like a very simple example, but There might be offices that are closed, but there's actually work available for the person to perform should they go to the office. But because of the quarantine, they're not able to go. And I think, you know, in our office, we have file clerks, folks who file we have tons of files that we have to go. We have a file room where we put all of our files, and new mail comes in, and then whatever it is that we have come in goes into the files. And so we have these file clerks that have to come to the office to do that work. And there's work for them to do, but our office is closed. All of the attorneys are working from home. Some secretaries are equipped with equipment and work from home. But otherwise our office is closed. So that would be an example of someone who could work, but for the quarantine. So that's an important example. And also the teleworking. If you can't telework, that's another way that it makes you eligible. And a person who does telework might not be eligible unless they have extenuating circumstances. Like in the example that they gave in the regulations was an attorney working from home. You know, we can do all of our work from home, most of it. But if the power goes out, we can't, right? That's an extenuating circumstance because we don't have a computer, we don't have the internet, and our work would be interrupted. And so if your employer allows you to and you can perform your job at home, you wouldn't be eligible unless this extenuating circumstance makes it so that you can't.
Councilmember Oddie, did you have any questions?
No, I didn't. Thank you so much. I'm glad to see my alma mater is still producing great lawyers.
Thank you. It's a good school. I really like to go there.
Sarah, did we have any other questions?
No, no more questions.
Okay, and Tiffany, thank you so much again for joining us, and thank you for providing the presentation. We'll be able to make the presentation available to folks after this as well. So thank you so much. I think that's a wealth of resources, and I'm sure Sarah can pass the information along to her brother. Hopefully he'll be okay and can get his income verified and apply on the 28th. So thanks everyone for joining us today. Councilmember Oddie and I will be doing these continuously. Our next one is going to be on, our next town hall is going to be on Wednesday, this coming Wednesday, the 22nd, following our meeting, our council meeting. We'll be giving an update on any emergency council actions being taken. We're considering a couple items relative to tenants and tenant protections, emergency tenant protections, and so we'll give an update on that, and we'll also be having a member of our school board on who can give us an update in terms of the distance learning and provide any answers to constituent questions that remain. Councilmember Oddie, did you have anything else?
And I think we're also having there's an agenda item for assistance grant money for our small businesses.
Yes.
So, you know, they've been bearing the brunt of this along with, you know, their workers, and, you know, other low wage workers are bearing the brunt of this. So, you know, this is uncharted territory, I think, for all of us. And we're trying to adapt as quickly as we can. I mean, for example, this rent ordinance is now going to be the third emergency ordinance for tenant protection. So, you know, we continue to, you know, adapt, and our staff continues to work hard. I see Lois is on the line, so give a big shout out to Lois Butler from our economic development team. And, you know, we'll continue to do that. So and I appreciate everyone who's sent us emails and comments and all that for more ideas, because, you know, we want to be able to, you know, support our residents, all of our residents, get through this. So thanks again for taking some time out on a Saturday afternoon.
Yeah, and so the ordinances that that council is considering, as Councilmember Oddie mentioned, is potentially doing $7,500 grants for small businesses and allocating funds for that. And then we're also considering a number of other potential actions like deferring business license fees and things like that. So we'll be giving an update on that. The other thing that I wanted to circle back to that I mentioned at the beginning of the meeting was that the county recently passed a new regulation requiring face coverings when you're out in public. I've been working with Chris Tam at All Good Living, and this afternoon / evening, we're going to be announcing and launching a place online where you can order masks from Chris at All Good Living, and it will be a buy one, give one offer. So you'll be able to buy a mask, and for every purchase, we'll be able to donate a mask to an Alamedan in need. We need at least 200 masks for our residents at Alameda Point Collaborative. That would mean 1 mask per household. We're hoping that we can actually get 400 masks through this buy one, get one, so that we can provide 2 to every household at Alameda Point Collaborative. And then we've also, I just wanted to announce, I've been working on fundraising calls this morning. And so we are going to get several hundred masks donated through generous contributions from some of our community partners. So that will all be launched on the web link that I'm going to put out later today. I'll post it on Alameda Peeps as well as on my page. I'm sure Councilmember Oddie will share it as well. We want to just make sure that every Alamedan who needs a mask gets a mask. And for a small contribution, which will include the purchase of your own mask, you'll be able to help somebody else out. So stay tuned, and that'll come out later today. Thanks so much.
Thanks again, everyone.
Thanks, Sarah.
Thanks.
Thanks, Sarah.